Welcome to Plant Your Seed. I'm your host, Fred Ferris. On each episode, we share stories of how ordinary people have transformed their lives. Each story is compassionate, each story is authentic, and each story is a transformation. Here are the stories of the people who are changing our world by transitioning to a plant-based diet. Today on Plant Your Seed, joining us from Florida, we have Dr. Melanie Worley. Dr. Worley is an emergency medicine physician, three-time Boston marathoner with a 2-hour and 56-minute personal best in the marathon, and an Ironman 70.3 World Championship qualifier. She is passionate about plant-based diets for both athletic performance and disease prevention. Welcome, Melanie.
Thank you, Fred. I'm so excited to be here. This is my first podcast as a guest.
Yeah, you have your own podcast.
Yeah, I do have my own, which is kind of up and coming, but this is the first time that I've been on someone else's, so very honored to be here.
Well, thanks for being here on Plant Your Seed. Can you tell us how and when you transitioned to a plant-based diet, and what was it about a plant-based diet that made it best for you?
Yeah, so around my junior year of college, I started thinking a little bit more about what I was eating. So I slowly made the switch to vegetarian. But prior to that, even when I was around 18, I kind of was already thinking about why am I eating meat? And I had those questions. But, with the social pressures of being an undergraduate student and surrounding yourself with all of these college students not doing that, it was a little hard. So I finally got the courage to go vegetarian when I was around 20 years old. And then I started watching some of those documentaries that we all know about, like Forks Over Knives, back in the day. And those really were eye-opening for me. So I slowly was able to make the switch to vegan as I was finishing up my senior year of college. But also during that time, I had noticed how much faster I had gotten during my training runs and how much better I was feeling and how fast I was recovering. So that was also why I had the courage to go fully plant-based after I realized that. So I had run my first marathon my senior year after making the switch, and I had qualified for Boston on my first marathon. So I knew that there was something that had changed from that diet. So that was what really kind of inspired me. And then those documentaries just really, showed many areas that I had not really been aware of. Just the animal agriculture and health and disease. But also, I knew I was going to medical school as well. And so I had looked into, somehow I found out about Dr. Esselstyn all the way back then. And I had looked into his cardiac studies and showing how we can reverse heart disease with a plant-based diet. So it was kind of a combination of all of those things with my background as a pre-med student, as a runner, that made me transition. And my mom was also an influencer in that as well, because she had kind of made the switch with me. And it was nice because our whole family was doing it. So when you have the support, it doesn't seem as out there. So that was also really helpful because I would come home and we were starting to make plant-based meals together. And even my dad was slowly getting on board. And then he was able to get off his statin medication as well. So we had a lot of positive changes, and that information that we gained from doing our own research and watching those documentaries was really helpful in making that switch.
Now, you said you got faster. How do you feel that you got faster?
Well, in high school, I did run in the state championship race my sophomore year, but then my times really just kind of started to level out, and I wasn't really making any improvement my junior or senior year. And at the time, I had no, clue about nutrition as a high school student. It's just something you don't think about. And I was drinking slushies and enjoying myself and not caring a thing about what was going into my body. And I didn't realize the impact that can play. So when I say that I got faster, I mean my training runs were faster, but also like my racing times were much faster. I was blown away. I ended up, running a 18:29 5K, which is 5:58 pace per mile. And back in high school, I couldn't even break 20 minutes. So here I am 10 years later on a plant-based diet. Now I'm 28 and I'm still running. I can go out and drop, low sixes on a 5K, even with minimal training. And I think that definitely is attributable to my diet.
What about your diet do you feel correlates to your training?
Well, I think it's I'm not left feeling sluggish because I've eaten heavy foods. I can just remember back before I was not plant-based, just feeling very sluggish after going out to restaurants and eating all these foods that I didn't realize were so high in fats and saturated fats and oily and those kind of things I never considered before. So I think that's part of it. But also just the antioxidants and all of those nutrients that I was starting to get from the whole food plant-based diet was really energizing me and also helping with recovery and fighting inflammation. So I was able to probably produce less lactic acid because of the reduced inflammation in my body. And so in turn, that leads to faster recovery after races. So I can even remember back in medical school, I did my first ultra marathon, which was a 50-kilometer race. And I was not even that sore the next day after that race. And I
Hmm.
do believe, my diet plays a big role in helping me promote recovery and leading to a performance advantage.
Now, you've run Boston a couple of
Mhm.
times, well, 3 times. And how do you feel after you've run something like Boston?
Well, of course, 26.2 miles, regardless of how you're eating, is a long event.
Mm.
And it's pretty tiring, but that 2:56 marathon PR that I got was in 2019, so not too long ago, and that was almost 6 years after going plant-based that I ran that time. And that race in particular, that's so for listeners that don't know, 2:56 is about 6:45 pace per mile for 26.2 miles. And after that race, I remember finishing and I was so happy because I so badly wanted that sub 3 hour marathon goal.
Mm.
But I remember feeling like I had more in me, actually. And I was like, wow, because I was walking around fine. I didn't have to, I didn't need any extra nutrition or anything afterwards. I felt like I could have kept going. So that's a sign too that I need to also learn how to maybe even push myself more in a race. But I think if I'm able to get to a finish line with that kind of effort on an endurance race and still feel great, I think that also speaks to kind of the impact that it's had.
What are you up to now? What are you training for?
So now I am training for the Ironman 70.3 World Championship, which is in October in St. George, Utah.
And how is that going?
It's going well. The biggest challenge for me is just balancing the training schedule with my work schedule. So that can be a little bit difficult, but I have used, I'm on a master swimming team
Mm-hmm.
in Florida, which is great. And I have a swimming community, but the coach that coaches the masters team happens to also be a triathlon coach, and he was very successful in the half Ironman distance. So I've started to utilize his help over the last month, which I think has been good for me because I'm following more of a structured plan. And so today I had the afternoon off after I had morning lecture. So I already did a swim and then I'll bike after this. So it just takes a lot of dedication and a lot of discipline outside of work. It's almost like my second part-time job. I enjoy setting goals and pushing myself. And it also helps me de-stress from a very stressful job in the ER so that it's good.
What is the difference between training for a marathon and training for an Ironman?
Oh, that's a good question. Yeah, so the marathon, you're just focused so much on running. All you do is run every day pretty much, or run 6 days a week. And at the time when I was training for that sub 3, I was running 60 miles a week and maxed out at 70 miles a week. So that was a lot on the body, definitely. And then for marathon training, there's kind of two key workouts, and one of them is the long run,
Mm-hmm.
but also one of is the tempo run, and really doing even some long runs at marathon pace are key. So if you want to run a sub 3 marathon, you need to be able to go out in a training run and run 10 miles at 6:45. Now, you don't do that, your first week of training, but around 16 weeks in, 4 weeks out from the race, you should kind of be able to hit your goal marathon pace in a long tempo run.
Mm-hmm.
So that's how. that's how you sort of approach marathon training. Versus Ironman, you have three disciplines to worry about. So you've got the swim, the bike, and the run. And you really need to be swimming at least twice a week, but three if you can, which can be a little difficult. And then you're biking usually 3 to 4 times a week, and then you're running about 3 times a week or so. So you're kind of doing everything and have to manage that. And then you have days where, especially if you have a day off, that you should probably do a double workout, like I'm doing today with a swim and a bike or a swim and a run. And then occasionally you do brick workouts, which is a bike and then a run. And when you're training for these Ironman distances, I mean, you really have to work up to doing a 3 or 4 hour bike and then still getting comfortable with actually running another hour after your bike. So it's very time consuming and it takes a lot of, like I said, discipline and planning and time commitment too. So I think the Ironman training is definitely more time consuming than marathon.
It seems it. Now, how long will it take for you to prepare for an Ironman versus a marathon?
They're not too different in terms of that. I started this training block build about 20 weeks out, maybe a little bit more. For the marathon, you can get away with 12 minimum if you kind of already have a good running base, but usually it's around 16 weeks. So yeah, I'd say the Ironman probably a little bit more. You want another extra month in there for Ironman training.
So about 5 months, and I can go run an
hmm
Ironman or do an Ironman.
Well, at least a half. In terms of the full Ironman, which is kind of my next goal, I think you have to have a few halves under your belt first, and then probably at least a year or two base of just general triathlon training where you've been doing Olympic distances, sprint distances, some half irons, and mixing it up. There's also like an international distance, which is close to the Olympic distance. But having those under your belt is going to set you up for success for those farther distances.
Now, what motivates you?
You mean to do Ironmans or
Yeah,
marathons
just
or
to
just to?
marathons, training,
Mhm.
and everything. I mean, it seems like you really have a lot going on in your professional life, and you found a way to squeeze in all of this training for marathons and for now Ironman. It's
Right.
fantastic.
Thank you. Yes. I am very goal oriented. And after I broke 3 hours in the marathon, that was kind of my major goal after I started marathon training. So I got, my first marathon time was 3:27, and I was able to take almost 30 minutes off of it, which is pretty impressive.
Mm.
And it's hard to do that, but it took a lot of work though, and many marathons to do that, so that was not overnight. But then, after I kind of finished that goal, I was in Florida where it's hot, and to be honest, I really needed to do some cross training. So that's what influenced me to get back into triathlon was the Florida heat, and then I also have great access to swimming and biking here, so that also helped. And it was just another way to give me a different goal. So I did my first half iron in October of last year during residency. That was my goal that I had planned for, and then I ended up qualifying for the world championship on my first half. So I'm a very competitive person. I played sports all growing up, basketball, soccer, lacrosse, track, and before I switched to running. And then, I accomplished that running goal. So I was just motivated to give myself another goal and push myself. So it just feels good after a race to know that you've kind of pushed yourself, done something positive. Then you can finish the rest of your day knowing you did something great for your body and just enjoy whatever you want the rest of the day.
Now, how did you feel when you qualified for that Ironman?
I was extremely happy. That was a great day. And I also had my family with me, which
Mm-hmm.
was even better. It was in Wilmington, North Carolina, where my family lives. So my grandparents were there, and my aunt and uncle, and their 4-year-old son. And then my parents were able to come down from Ohio. So it was really nice to have all my family there and their support and see me qualify for Worlds.
Who inspires you?
Ooh, that's a good question. I mean, definitely, being an only child, definitely my parents.
Mm-hmm.
My mom was sort of one of the reasons I had mentioned that earlier, that I went plant-based. And, my parents are very hardworking people, and they've worked hard for what they have now in life. And they were young parents at the time. They had me when they were 20 and 21. So I
Mm.
know that wasn't easy. So watching them just kind of be able to take that all on and still be very successful in their careers and manage all of that, just inspires me. And it's nice to see them also taking charge of their health, because I want them around for a while since they're still relatively young for parents.
Mm-hmm.
So it's nice to see, my parents are very active. They've always been good role models in terms of that. My mom's always worked out, as far as I can remember. And my dad's the reason why I started running. He was actually my cross country coach when I ran the mile in grade school.
Mm-hmm.
So actually, I remember I was 10 or maybe 8 or 10. I'm not exactly sure how old, but I remember watching him run the Columbus Marathon. And I was jokingly being like a news broadcaster on the sidelines, filming with my mom my dad racing. So yeah, I think they've both been very good role models and influencers in my life in terms of just inspiring me to push myself and do better. And my dad is the reason why I got into running. So,
So take us back to that day when you're 8 to 10 years old and you're announcing your dad's marathon.
so that was the Columbus Marathon in Columbus, Ohio. And I believe that was my dad's marathon PR. I always kind of joke with him because I beat him pretty good on that time. So I give him a time. But I think he ran around 3:43 or so that day. And I remember he had a sweatband on his head. He thought he was really cool with his little Nike headband. And there's a good finished picture that we still have in our house with him on there. So, I think just having that influence of being active and pushing yourself, when you see that when you're young, it instills that in you when you're older.
What do they say to you when they see you doing all of this?
Well, I think sometimes they think I'm crazy secretly. But then my mom jokes that she's like the pro spectator at this point. She knows how to like look at race maps and plan out where they need to be to cheer me on. So we always joke about that. And then I remember too, it was my dad's birthday when I was doing the Ironman in North Carolina. And so I got him like an Iron Dad shirt with the Ironman logo, and he really enjoyed wearing that race day. So just things like that, I think.
When you were transitioning to a plant-based diet,
Mhm.
was there anything that you struggled with?
I would say, eating out with friends is probably a big one, because inevitably you get a lot of questions and people kind of see you as the outlier when you
Mm-hmm.
say you're vegan at a restaurant. So that was one of the harder things in the beginning, especially because I was still in college too. But I think that's definitely gotten better as time has gone on, and as you age, you start to care kind of less about what others think too.
Now, what did you learn from that experience?
That's a good question too. So, I just think that you learn that you have to do what's best for you, and others might not agree with it. They might have a different perspective or opinion, and that's okay, but you have to do what you think is best for your body. And at the end of the day, if you know that eating plant-based is not only going to make you more healthy, but make you feel better and make you a better person, and you know that you're having a good impact on the environment and animals and all of those things, then you shouldn't let other people influence that.
Was there anything holding you back? You mentioned you went vegetarian first. Was there anything holding you back from becoming vegan?
I think one of the things was just the setting, being in college and being so young. You don't really know how to approach it. I think that would be one thing that was holding me back. But also just culturally, it's very difficult. When you grow up eating one way and you switch to this other way that people are not so familiar with or don't think is really right or thinks tastes bad, or, vegans just eat salad, that kind of thing, or you eat grass or rabbit food. That's the common things that people like to say. So I think just all of those factors might have held me back initially, but after I realized how good I was feeling and the more and more documentaries I watch confirming that I just with all of that information, knowledge is power
Mm.
is what I like to say. And I'm someone who kind of if I get information and I take a look at scientific evidence and it looks pretty convincing, I'm kind of the type that's not going to go back another way, especially with that scientific background of mine. So that's another thing I like to talk about too with physicians. So being a physician, we talk about evidence-based medicine left and right. I mean, we have lectures on it all the time where we're reviewing literature, you know, meta-analysis or journal articles or things like that we're reviewing about XYZ, like which drug to give a patient for this. And I could go on and on about, the different types of studies, but my point is that some of the best evidence-based medicine that we have as physicians is really like food as medicine, and it's never talked about at all, and it really drives me crazy because that is the reason why we have, the number one killer is heart disease is because of lifestyle factors. And it's amazing how people with stents who come in with a heart attack will never once be talked about, their cardiologist will never take the time to even talk to them about diet or mention anything about plant-based diets or the evidence out there. That's just one example. But it's kind of tough because, physicians are supposed to be so smart and we're very educated and I'm on year 11 of my training and we hardly get any nutrition in all of those 11 years. But I was fortunate enough to do it on my own and learn all of this stuff on the outside, but that's very rare.
Now, why do you think that is?
I think part of it is one, the lack of education in medical school. There needs to be a more focused lifestyle based education approach when it comes to nutrition. That's one part. Number two would be the system. Our healthcare system is not set up for preventative medicine. It's very, very reactive medicine. And also, the hospitals are reimbursed for procedures.
Mm-hmm.
So they're going to make a lot more money putting a stent into somebody's heart than they are telling them to eat plants.
Right.
Which, I mean, that's also another, that's a pretty controversial topic in and of itself, but it is kind of true. And another part would be too that physicians tend to not eat the greatest in general. I mean, they're like everyone else. They're humans, just like anyone else, and
Mm-hmm.
they're not really they're not really thinking about the food that they're eating really being related to disease, which I find so interesting because I've kind of watched this now for 7 years between medical school and residency. People just don't put two and two together. They don't see the connection. And I do try to empathize because I know I didn't always eat this way, and I understand that it doesn't happen overnight, and people are all on their journey to eating more plants. So I totally try to see both perspectives and both sides. But it's very interesting to see how physicians aren't really noticing the connection. And we learn, and I think part of it is how we're taught in medical school. So, we learn that risk factors for coronary artery disease or cardiac disease are high blood pressure, hypertension, diabetes, family history. And not once is diet ever listed, which
Mm.
is crazy to me. It's crazy. Why do we get hypertension in the first place? Where does diabetes start?
Right.
Insulin resistance starts with high animal protein diets. And I actually had Dr. Neil Barnard talk to my medical school because I was president of the Lifestyle Medicine Club about that. So yeah, I've been passionate about this for quite a while now and trying to spread the plant-based message as a physician, but it's definitely hard in our system for sure, the way it's set up.
What do the physicians say when you bring that up?
Well, I don't really bring it up is the problem because I don't It's tough. They're my colleagues, and I want to have a good relationship with people I'm working with every day.
Sure.
So it's not really something I discuss in that way with them, just
Well, do
because I
you
want to.
do you get their opinion on it? I'm not saying that you challenge them. I'm just saying that do you throw it out there and find out what their opinion is on that?
I haven't directly said anything, but I I've done enough events. Like I also had Dr. Esselstyn speak to my residents as well. It was an optional event, so only about half of the people stayed.
Mm-hmm.
Uh, but I've had direct comments like, "Well, I don't really want to hear what he has to say because I want to continue to kind of eat what I want to eat."
Hmm.
So they're almost aware of what they're doing is wrong, but they don't want to know, or they want to continue to be kind of silently unaware because to them they want to keep eating the same way.
That's interesting. How do we go about changing the medical school and getting more nutritional information into the curriculum?
Right. Yeah. I think if lifestyle medicine, like the American College of Lifestyle Medicine, could potentially get involved, that would be one way. Having some type of national, that would really have to be more of a policy implemented, some type of national program where medical schools are required to provide X amount of nutrition. But then that also can become a little bit tricky because are they going to be talking about just general nutrition, or are they going to be really showing the evidence that we should be eating as much plants as possible? Because if you also look at like registered dietitian schooling, I mean, that's not really a plant centric education.
Mm-hmm.
They're taught all of the my plate things and still some of the old school thoughts in terms of getting your protein and other things on your plate. So I think that's a challenge to implement it. But yeah, we definitely need some type of implementation via policy for medical schools to educate regarding this.
What is one thing that's exciting you right now in your life besides the half marathon?
Well, I'm about to start sports medicine fellowship, which I'm really excited about because I think that I'm going to find my groove a little bit more just with my background as an athlete. I
Mm-hmm.
think taking care of athletes will be really fun and getting people back to doing what they love and getting them back to being more active again is also a really cool job. So, someone with shoulder pain, being able to help them, whether that's through an injection or physical therapy or things like that, and then they can go swim again or, do what they want to do. I think it's a really nice change from the busy ER. Although my ER skills are still going to be very helpful for any traumatic injuries or things that might happen on the field, like especially with football training, heat exhaustion, things like that. So I think I can really I'm excited to utilize my emergency medicine background with sports.
Can you take us through what exactly is sports medicine fellowship?
Yeah, so I'm going to be doing a primary care sports medicine fellowship. So this is non-surgical or non-operative sports medicine. So I'm not going to be doing like ACL repairs or rotator cuff repairs like an orthopedic surgeon would, but I'm
Mm-hmm.
going to be able to diagnose and treat any non-operative sports injury. So maybe you have like a rotator cuff tendonitis, or you have some patellar tendonitis from running, like runner's knee pain, things like that we are going to learn about diagnosing and just basically treating any type of musculoskeletal injury or issue. That's kind of our focus is the MSK system. So all of the joints and being able to examine the shoulder, hip, knee, elbow, and kind of diagnosing pathology from that. But also, being able to manage concussions. So players who have had concussions, how to get them back on the field, or players who have been injured, how do I get them back on the field safely? And there's also a lot of interaction with athletic trainers where we have to know how to talk to them and kind of see how an athlete's doing with them and what their rehab is like and how we can get them on the playing field. So it encompasses a lot, and also treating general medical issues like maybe exercise induced asthma, and I mentioned before kind of like heat exhaustion things and electrolyte replacement, It encompasses a lot, so it should be exciting.
What is it about exercising that makes you so passionate?
It just makes you feel good, you know? So for me, it's that endorphin release, and I always feel I've never regret a workout. I might not want to do it initially when I get started, but I never regret one afterwards. And for me, it's also about I'm stuck inside a lot when I'm at work. So for me, it's my time to, get away from my cell phone, just have my watch, my sunglasses, get out the door, and then the Florida sunshine. I mean, it's hard to have an excuse to not get outside. So it also is being with nature, grounding yourself. Those are the reasons why I really like it.
Seems like you're very passionate about food and exercise.
I am, yes. That's why I've started my new Trained on Plants project.
Why don't you tell us about that?
Yeah, so I have an Instagram called Trained on Plants, and I also have a podcast as well, the same name. The focus is on, sports medicine, lifestyle medicine, plant-based nutrition, and running and triathlon. So it covers a wide variety of topics. But my main goal is to, show that the performance advantages of eating a plant-based diet and being an elite athlete. That's one of the main goals of it, but also for disease prevention. So that's really important, especially like I mentioned before, heart disease, but also preventing a lot of the major chronic diseases that I treat all the time in the emergency room. It's about both discovering the benefits of a plant-based diet for both disease prevention and performance. So I want to be able to also not only reach general people and patients who want to start eating better or want to start eating more plants, but I also want to reach athletes because athletes actually tend to have some of the worst diets because, they're exercising so much, they are burning so many calories that they think, oh, well, it doesn't matter really what I'm consuming, I just need to eat. That's one
Mm-hmm.
of the mindsets. I want to change that a little bit too because, yeah, when you're young, you might be able to get away with eating kind of whatever after a workout, fine, but for the longevity of that person and the long-term health consequences of that, we see a lot of runners who do have heart attacks actually at quite an early age. And there's even been studies that show that there may be some cardiovascular damage that occurs with too much endurance running, and that plant-based diets have actually been shown to curb this. That was actually a study I mentioned on my Trained on Plants account.
Hmm.
And then I know Dr. Greger had mentioned on nutritionfacts.org that they took arteries of runners and then they took arteries of vegans who were not considered very active. And the vegan arteries were much clearer on catheterization
Mm-hmm.
when they looked at the plaque buildup. So I found that very telling as well, that we just really can't outrun a bad diet. Also, too, another thing that physicians are taught that, family history plays a big role. Or a lot of patients will in the ER will say, well, my dad had a heart attack at this age, and they're very quick to like blame their symptoms on family history.
Mm-hmm.
When if you look at the data, it's really only like 5 to 10% genetic slash family history. It really is at least 80% lifestyle. So that is huge because our top killers, I mean, 7 of them, or most of them, are all chronic diseases related to lifestyle. And so if we have the power to change that, like right in front of us with how we're eating, that is huge. And I want to be a physician who is helping people realize that, that's why I've created this Trained on Plants, because I want to spread that message. But with my training as a doctor as well as my training as an athlete, I think it's a perfect combination to kind of get that message out there to the world and influence people, whether you're an athlete or not. I mean, you want to be eating plants regardless for your health and disease reduction risk.
How difficult is it to see patients in the ER that you feel could have, I guess, been better off if they had had a plant-based diet?
Well, the problem is that most of the patients that you are asking about have not really been educated on it. So that's the reality. And I actually had a patient recently, about a couple weeks ago, who came in for some chest pain. And she was the sweetest lady. She was so kind. She was so pleasant. Um, and she said, well, I do eat a lot of vegetables because I'm actually one of the only ER doctors that does occasionally ask about diet. And I do discuss, particularly with chest pain patients, I tend to bring it up because I
Mm-hmm.
think it's a great opportunity, especially if I'm sending them home, because it gives them something to think about and to maybe change before they get to their doctor. So I remember talking to her and she's like, well, I do eat a ton of vegetables. And I said, well, that's great. And then she said, but she also eats a ton of chicken and turkey and lean meats. And, I was there. I was there before I made the switch to vegetarian. I thought those lean meats were healthy. And that's kind of a marketing campaign that's been put out there that white meats are better than red meats and all of that. But if you really look at the studies, they raise cholesterol just as much. And
Mm.
then also when we're cooking those white meats, we still have the carcinogens that are being formed and all of that. But then again, too, you have what the animal's consuming, like soy or corn products, and then you're indirectly eating that as well, and all of those factors. But anyways, um, no one had really talked to her about fully a plant-based diet and kind of seeing if getting rid of those could help her because oh, the other thing that this patient had told me was that her cholesterol was high and her doctor wanted her to start her on a statin. But
Mm.
she had just started the statin. That's right. So she had just started it a couple weeks in, and she wasn't really liking the way it made her feel. And then she was telling me about her diet. So that's how we got on this topic. And for those that don't know too, statins, I'm not a huge fan of them. I think they're a false protector. They can lower your numbers, but you can still have rupture of plaque if you're not eating correctly. So that's a whole nother thing I could get into. Uh, but yeah, statins also have can cause muscle breakdown and rhabdomyolysis, and I've had a lot of people tell me they felt very crampy and just not that great on them. So, why feel that way and take a medication to make your numbers look good when you can just change your diet and see if that helps, like my dad did. He was able to get off his statin, as I mentioned earlier. So, yeah, so this patient was extremely receptive. She wanted to know my information. She wanted to know my podcast on the discharge instructions. I mean, I was so happy to see um, someone so eager and willing to listen.
Mm-hmm.
And I think we need to remember as physicians, people really are willing to listen. They might not change overnight. It might be a very slow journey. It might take them a year. It might take them 2 years. But we really do have the power to influence people to better their health. And for me, I'm already a role model of that. I mean, I like to feel that way, at least with um, my plant-based choices and my exercise. So now I want to influence other people to do that and help them lead healthier lives.
How does it make you feel when patients start to take control over their own lives?
I love it. So that is so great to see that example in particular, just someone being so eager to get off a medication and want to do something to better themselves. You can't ask for anything better. So that's why I want to get more and more into lifestyle medicine. And I plan to get board certified because the more people I could help do this, I would be so happy and fulfilled. I mean, that's what I feel like where my passion really lies and what I should be doing. I feel like that's my calling as a doctor. There's kind of a reason I think that I was influenced to make the switch on my own and share it with other people.
Now, being so busy, what is
hmm
one habit, hack, or tip, or another way that helps you stay on track with your plant based diet?
I think one thing would be just having quick, easy go-to meals, like have a few meals that you know how to whip up really quick and that taste good, that are simple to always have those items in your household is one way.
Mm-hmm.
For me, I've also used a local uh, plant-based food company here that has I go in once a week or so and kind of stock up and take those foods into work because I'm so busy. I don't really have the time to meal prep or cook. Like I worked the last 9 out of 10 days in a row just now to put that into perspective. So I need something quick and easy. Um, so for me, I do that, which is an option for people if people have a local Whole Foods service they can utilize. I've also used Plantable, which is a meal delivery service, and Sakara is also very good. Those are all very whole food, good ingredient meal services for people who are short on time.
Now, when you work 9 out of 10 days, do you
Mhm.
train at all during those times?
Yeah, I actually did manage to train almost every day during those times. So, you got to plan it out and you have to just put it in a spot that works with the schedule. So, for example, on Monday, knew I was working 11 to 11. So I woke up and started my workout around 8:30 and got an hour and 10-minute bike ride in.
Mm.
And then today, before I worked 11 to 9, I did a 4-mile run. And over the weekend, I was working 9 to 9 all over the weekend, and I still ran 5 miles before work on Saturday. And on Sunday, I still did some yoga and core. So it takes a
Nice.
lot of motivation and planning, but I personally feel so much better going into a shift knowing that I moved my body. So for me, I'm able to take care of patients better if I do something for myself first. So I think that's another thing that people should keep in mind.
What cookbook, book, or documentary have you either gifted or recommended most to someone transitioning to a plant based diet?
Oh, that's a good one. I think there's two that I would say that I usually recommend, and one is How Not to Die by Dr. Michael Greger, and the other one would be Dr. Esselstyn's Preventing and Reversing Heart Disease.
Is there a reason that you choose those?
Well, for me, those both are kind of the some of the best scientific evidence books of why we should be eating plants. So I love that from just a science background. I really appreciate that. And I just think that Dr. Esselstyn's work is underrated, and I still can't believe a lot of people have never heard of him.
Mm.
Just what he did was pretty amazing at the Cleveland Clinic. So I like that. And, when I had him speak to my residents, my program director, he is a hardcore meat eater. I mean, yeah, he's been doing that for 60 years. But what was amazing is that we were out in Montana on vacation together, going skiing and snowboarding because he has a place there.
Hmm.
And I bought the Preventing and Reversing Heart Disease book in Montana. He had bought it and he told me he was eating lentils and brown rice like 4 times a week now. And that
Wow.
yeah, trying to eat more plants. So the fact that I had that much influence on my program director, who's been eating the same way for 60 years, and I know he's on a few medications. I mean, that was so cool to see. And again, that's sort of my goal. And just 2 days ago, I had a cycling friend send me her Impossible Burger, and she said, "You've inspired me to try something new."
Hmm.
So, Impossible Burgers, I know some people out there, yes, they are a little processed and you don't want to be eating those every day. But I'd much rather have someone eat that once a week, or, every other week in place of other things. So,
Now, how does that make you feel when you influence people to change their diets like that?
I mean, it just feels awesome, to have that kind of impact and to be able to kindly offer some of the knowledge that I've accrued over the last 8 years, and having someone listen and be willing to try. It's a great thing.
Now, finally, can you give me one word to describe how you felt before you became vegan and one word to describe how you feel now that you are vegan?
Hmm. I would say before, sluggish would be a good one.
Hmm.
And after, I would say empowered, because, being vegan, I just feel like people will have their opinions. They may not like it. They may think I'm weird, but I know deep down I'm doing what's best for my health and the environment and the animals.
Such a pleasure speaking with you. Thank you so much for taking the time. Now, what's the best way for people to follow you on Instagram, the web, and listen to your podcast?
Yeah, so thanks so much, Fred, for having me. This has been a great hour chatting with you. And they can find me at Trained on Plants on Instagram and www.trainedonplants.com. And also feel free to email me with any training questions or how to get started on a plant-based diet at trainedonplants@gmail.com.
Thanks again, Melanie, for being on Plant Your Seed.
Thank you.
Hope you are inspired by this story, and remember, it's never too late to plant your seed. Links to everything we talked about on the podcast can be found on Instagram at plant.yourseed in the show notes tab in the bio. If you enjoyed the show, remember to leave us a review, and until next time, thank you for listening.